All right, we'll get started. Mark's wondering if I was going to play the piano this morning. I think he's a little disappointed that I wasn't, but really overall he's probably tickled when that get heard to sing that. But I'm going to eye doctor. When you live in Burdstown, you're so far away. When you get, years ago, us old people, boy, it was great to get to go to town on the weekends. Hey, we might get to go to Big K. That was our big thing, going to Big K. So this is kind of like when I get an opportunity to go to Cookville, I try to take advantage of it. So I had an eye doctor appointment this morning, and had them dilated, and they're a little. Everybody looks a lot better today. So I talked to Tommy Lee for 15 minutes before I realized it wasn't Mark. But I'm just glad to be here. What was it? Jerry probably remembers back last summer, I believe, I had eye surgery on one eye, and they did remove the cataract and did that little implant deal. I haven't worn glasses since. Honestly, I couldn't pick up, I couldn't read my phone or watch or anything. Getting ready to do the other eye that now in a couple of weeks or a month, so that hasn't worked out well, so I'm going to try another one over Dr. Hudson. So I'm tickled with her, and so I'm going to do that. So hopefully that'll work out good, and I won't have to wear glasses at all. So
If you're successful, maybe I can get rid of this.
Hey, I was very surprised, and I haven't had a pair of glasses on. And I did ask them over there. I said, "Now look here, can I get a pair of glasses to help this eye out a little bit? If this one's blank, just knock the lens out and throw it away, and get a bifocal for this one." And but I believe I'll go with the surgery part. They said you got a borderline, so I'm going to go with the surgery part because it was a lot better, a lot smoother and everything than I thought. A little bit more. I know y'all get to, this is a short meeting, so I get to talk. Today, April Fool's Day. Back
Why don't you look at me?
Back 48 years ago, my wife and I got married, and I said, we need to do this on the day that I can remember. Or forget things. So Mark, I asked her, I said, "Now, what do you want? Today's her anniversary. I can take you to McDonald's, I can take you to Chick-fil-A, or we can go to the Holiday Inn Express, whichever, where you want to go." We'll probably go to Rib City. So that's but no, I gave her, just a matter of fact, in the parking lot, she dropped me off once I had still a little blurry. Bought her tickets for Diamond Rio up in Country tonight, and that's her favorite group. And she's gonna watch them tonight, and she'll go next week and watch them again, and she just loves them. So, and they do a good job. So, but yeah, this is our 48th anniversary, so it's a good way to celebrate. One more coming in. All right, open the meeting. You got Sherry, call the roll.
Sam Gibson,
Here.
Charlie Whitaker, Keisha Richards,
Here.
Sidney Putnam, Christine McMiniman, Bill Fox,
Here.
Christy Palin,
Here.
Bill Gibson,
Here.
Ann Stamps,
Here.
Michael Burton, Tracy Long, Nestor Chavez, Misty Fife, Barbara Wheeler, Bob DePriest, Patty O,
Here.
Morgan Jones, and Cole Wiggins.
All right, we're gonna turn the nail loose and put her in charge. Carry us through.
All right. Before we get started, I would like for us to do introductions because we do have a new policy council member with us. So, Nestor, if you don't mind to start and just tell everybody where you work, what you do, a little bit.
Well, my name is Nestor Chavez. I'm HR for UCHRA.
I'm Keisha Richards. I work for the Crossville Housing Authority, and I run their FSS program. I'm in stamps with Volunteer Behavioral Health Care, Center Director in Crossville and Livingston, and do some community outreach.
I'm Christy Kelly. I'm the regional coordinator with Tennessee Christian Children Aid, and I cover the Upper Cumberland region.
Barbara Quitter, and I'm Jackson County's consumer rep.
Patty Ann Newman, I'm a CSEC employee, and I work here for the administrative department and also coordination.
I'm Tracy Long, I'm dedicated appeals and theater. We run space at UCHRA.
I am Morgan Jones. I'm with Cedar Recovery. I'm a lead CPRS. Cover the Upper Cumberland and a little bit of Middle Tennessee.
Welcome.
Thanks.
Full Fox, I'm with the lady here.
I'm Bill Gibson, I'm with Power Putnam, the Substance Abuse Prevention Coalition for Putnam County.
Sam Gibson, I'm the city mayor, big city of Burnston, and chairman.
I'm Mark Bartlett, I'm the executive director here at the Development District and Human Resources.
And I'm Lynell Dodson, Deputy Director for UCHRA and also the Community Services Director.
Sherry Thurman, Administrative Services Director, UCDD, UCHRA.
All right, so we just want to do that for Morgan so she can kind of see if you guys have business cards or anything you want to exchange after the meeting. I'm sure she would appreciate that to try to help her get plugged in. So before we jump into our big schedule today, I did want to let you know that there's a copy of the bylaws in your binder. That is something that our funders like to make sure that you are aware of those. There have not been any changes to the bylaws since the last time that you looked at those. We try to keep those just available at any time. Feel free to take those. They may be in the front pocket or on the tab. Okay. So feel free to take those out. As always, take any of the information out that you would like to take home with you. We try to just have this compiled so it's easy for you to look at. Also, you'll notice there's some dashboards. The dashboards that we present are services that are run through our 14 county offices. So we've been making a really big push on general assistance and information and referrals. So I'm happy to see that that is starting to increase. Those are type of services that we're doing. We may not have funding, we may not have a specific program, but under that general assistance, we could be helping them. We could be with a food pantry, giving them something, or through our CSBG services, we're helping with resumes, we're helping with job application, things like that. Something that's not really tied to any specific funding program we have. So we're very pleased with that. The LIHEAP program is up and running for this year. Of course, there were lots of changes with that, so encourage folks to either call their local county office or they can apply online. If they need more information, your county coordinator from your office, from your county is the best person to talk. We do have our county coordinators, most of them in the back of the room, so after the meeting, if you would like to touch base with any of those, you're more than welcome. Does anybody have any questions on the dashboard before we jump into the theme and the topic for today? All right. So today we wanted to really focus and have our roundtable discussion on breaking the cycle. So the goal, we want to gain input from the Policy Council on regional service gaps and help develop strategies to dismantle stigma surrounding recovery in the Upper Cumberland. So what we thought we would start with today is we are going to have staff from both UCDD and UCHRA that work in the recovery arena come and do brief overviews about what programs through both of our agencies that we already have in place. Then what the discussion we would like to have is what is missing? What gaps do you see? What are the barriers to the programs that we're already running? And also, if you know of other programs that are specific to your county or something that you've heard about that you would like for us to research for the Upper Cumberland, this would be a fantastic time to start sharing that with us. So first I'm going to turn it over to Mark Farley and let him talk about the transitional housing aspect of what we're doing. And then we have some folks, if you guys want to come on up and sit at the table with us, we'll just jump into the rest of our recovery programs. Mark?
All right. Let me step back just a little bit. Obviously, when we look at all the recovery programs that we're operating through, either UCHRA or Upper Cumberland Development District, for the most part, they all start from a lens of workforce development. You know, back a long time ago, when we were in our old building, the discussion come up about the effect that recovery or substance abuse was having on our employers and the struggles they were having. And I never forget, it's one of those meetings, that was when Michael Nesbitt was on board, that was probably before your time.
I remember.
I'm sitting there and we had talked about what we had on our agenda, and I'd already moved on to the next item, and they get to talking about substance abuse. And I never forget, Michael Nesbitt, in his big booming voice, said, "Mark, you need to do something about that." And I'm like, what? You know, that's not a world that we'd ever thought about, recovery or substance abuse or anything, but obviously it is a big effect on our economy, not just on our economy, but our quality of life for the region. So we started trying to see what was missing in the upcoming. Now we have, let me back up, we have some of the most fabulous partners when it comes to recovery. We have some faith-based partners of recovery. We've got some gurus. I'm going to say right down here to my right, Bill Gibson, you have been a leading advocate for this issue of anything recovered for how long? I don't want to say a year, but years you've been involved in it. 20 years leading the way. And we've had volunteer behavioral health that's been a core partner in this region doing work for a long amount of time. I know they've been here a long time. I mean, what was I never understand. It's volunteer behavioral health, but we always called it Flat-top.
Yeah.
But it's a collaboration. So it goes back years, that volunteer behavioral health. Morgan, you come to us from Cedar Recovery. I'm going to tell you, Cedar Recovery has been a great addition to our region. The work that Cedar does and the services that we need through Cedar Recovery. So we've had tons of those. The development district, and I'm going to turn it over to the experts and be quiet. One of the roles that we do is we do housings for specialized individuals. So we run a lot of housing for seniors, those who are disabled. We've got targeted groups that have a hard time finding housing, like migrant farm workers down in Warren County. And we try and fill that gap for those individuals that the market is just not taking care of it on its own. And one of the areas where we realized when we started looking, you know, we have some communities that have good transitional home opportunities for people in recovery. There's a lot of gaps. So one of the things that we have done is we stepped up. We started out in DeKalb County. Myra Walker is my housing director back there in the back. We were able to get grant funding to start a women's house in DeKalb County. We can house up to 8 individuals there. It is actually working with the city of Smithfield. They were very active. They wanted to do something, very involved. So it was a great partnership we had with the city there to start that. And then that led to our second house in South Carthage, which is in Smith County. And it's a men's house. And it's the same. We can house 8 there as well.
Yes.
And that's in a partnership with the judge down there and the recovery court system. And it's a great partnership we have. But that's just a small component. We want to try and look and see if there's other opportunities. And I know Myra and her team are looking at other communities where there's not opportunities now, and how do we increase them in those communities as well. So it's a gradual process of adding. So that's what the development district is doing on housing.
Fantastic, thank you. So if you guys can just jot down any notes or any thoughts, we're going to keep rolling through what programs we have. So Michael, we'll just go with you, and then we'll move on to Brittany and Ryan. Amy, I think we're ready for the video.
Welcome to the story of Upper Cumberland Recovery Connect, or UCRC. We're sharing how one rural region is transforming the path to recovery. We begin with the challenge facing our 14 counties in the Upper Cumberland. Substance abuse is a quiet crisis here. It's not just a personal health issue, it's a workforce crisis, contributing directly to poverty and straining our communities. Across our rural landscape, the path to help has been fractured and inconsistent. Services are scattered, hard to find, or simply non-existent in many towns. Recognizing this fragmentation, we created a new vision, a connected ecosystem. The solution was not another isolated program, but a true regional ecosystem where every part supports the others to create a healthy, thriving recovery environment. This ecosystem is built on 6 core pillars: harm reduction, demand reduction, social determinants of health, supply reduction, treatment, and finally, recovery. The Upper Cumberland Human Resource Agency, UCHRA, acts as the connective tissue, providing essential wraparound support for up to 2 years, with long-term employment as the ultimate goal. We innovated with the Ride to Recovery program, using peer specialists as drivers to overcome transportation barriers, and partnered with the Department of Corrections for day reporting centers as alternatives to incarceration. So what does this recovery ecosystem look like on the ground today? The program is people-centric. A certified peer recovery specialist is dedicated to every one of our 14 counties, acting as a guide and a resource within a single connected regional network. Our work is guided by deep expertise, including a licensed clinical director, a nurse practitioner with SUD treatment experience, and a doctor specializing in addiction science. Everything we do is grounded in a core set of beliefs about what true recovery means. We define recovery not just as stopping drug use, but as a process of healing, actively managing vulnerability, and building a healthy, productive, and meaningful life. Our core principles include the belief that hope begins with structure, and long-term stability comes from strong, non-competitive collaboration. We honor the immense energy required to heal and rely on the power of peer support. We operate from the fundamental belief that everyone wants to be well, and we are there when they are ready for change. The Upper Cumberland Recovery Connect is our region's powerful answer to a fractured system. It is a collaborative, strategic, and living ecosystem designed to provide consistent, compassionate, and effective support across all 14 counties. By continuing to work together, we are committed to filling the gaps, overcoming barriers, and building a healthier, stronger, and more hopeful future for the entire Upper Cumberland.
I felt like that was a message.
Morgan, you know what they got?
That's Paul, yeah.
So, you know, I can't even start this conversation without talking about Glenn Sage for just a second, because Mark will tell you, Glenn he was the dreamer. He works over Substance Use Solutions, which is now UC Recovery at the start, and he had this amazing idea. And so, I mean, it all kind of started right there. And so we have had the opportunity since then to just really cultivate that initial work and turn it into something. I was brought on 5 years ago with a ARC, Appalachian Region Commission, grant to do recovery to work, where we were trying to build a system for bringing folks to recovery-friendly employees. And so we've been fortunate enough, again, I'm going to just talk to that side of it from the development district side, but from there we've been awarded a new grant under this ARC also, and it's for 5 years. And we're taking that initial work that we did those years back, and now we're going to look at certifying employers. See, the hardest thing for an individual that's new in recovery is to go to that employer, or go file for a job and get to that door and go through. I mean, it takes so much energy just to walk in and then get told by an HR director that unfortunately your past, or your background, or all these disqualifiers hit you. So what our aim is with this program is to find out all those details. To talk, put employers through some trainings, 5 of them, that'll talk not only about mental health, but we'll do Narcan training on site in employers' places. We'll talk about substance use in the brain, and we're going to have some other topics. We're going to ask them to just take, some proficiency things to make sure, and then make a commitment to being a recovery-friendly employer. But here's the biggest part, and it sounds so small, but it's so huge for those that are trying to get, in a job, and that is, we're going to identify them with a sticker. You've got a flyer there, and that recovery-friendly TN sticker is what we're going to eventually identify with. So an employer will be able to put that on their building, or in their links, or in their ads, or even in any kind of advertising whatsoever. And when that individual goes to that place for the first time, just think about that. There's no more worry. There's no more concern about being, who I am. And you'll have that feeling knowing that this place will take you as you are you know, and all of a sudden you have hope right there walking through the door and you can be at your best. So that's kind of the work we're doing there with the DD. We're focusing heavily into workforce development and doing a lot of things with internships and things of that nature also. So let's just be honest, that's one small piece of a very big project. And we have not only Brittany here, which she'll take it, and then the guy who said something about Ride to Recovery, and that was a brainchild of Ryan. So we'll let them go next.
Hi, I'm Brittany. I'm the program manager for the UCHRA Recovery Program. As the video said, we have 14 CPRSs, one in every county. These guys work diligently every single day with clients hand to hand, one-on-one, through their recovery journey. No matter where they are when they come to us, if they're in the process of needing detox, if they need rehab, whatever the case may be, they put all of those pieces together that somebody needs in order to start recovery. They have the ability to transport people, like Michael said about Ryan's brainchild with the transportation piece. They also teach them recovery skills, teach them how to cope with things without using. Also go through different aspects of working with them to get jobs, working on in different types of employment skills. There's a vast more, well, we don't have enough time for me to tell you everything, but there's a whole huge majority of things that they can do. The one flyer that you guys have that says UC Recovery on it, there's a lot of data on there as far as the people that we've worked with so far. This data runs from March 1 of 2025 to February 28th of 2026. I can say it's far surpassed my expectations of the program. So they're doing a great job, and I couldn't ask for a better set of people. All of the numbers will show you kind of like what we've done, what's gone on. At any given time, we have roughly about 250 active participants within the program. So I guess that's all I've got, Brian.
I am excited to be here to talk about this. UC Recovery Connect, just to see from sketches on a giant Post-it note from Glenn Say's throwing stuff and Michael Miller coming along, and we're just throwing stuff on this Post-it note to see what sticks and to see it come to life. And to use a saying of Michael Miller, we are building a blueprint on how to build a recovery ecosystem in our region that can be implemented in other areas of the state and nationally. And the next piece of the ecosystem is workforce development. How do we take people from a crisis point of on the street, wondering how they're going to live, to giving them hope, to connecting them to resources, and then getting them ready to join the workforce and be a productive member of society. As a person who survived addiction, that is the thrill of saying it is possible for anyone that wants it and that's willing to go through the process. I just submitted an opioid abatement grant, and one of the questions is, how do you measure success of this program? We can look at the numbers. They're impressive. But how do you really measure the success of a recovery program is the one person who succeeds their goals. The one person who gets their family back, the one person who keeps a job longer than 90 days, the one person that says, I too made it, and you can too. And that excites me, to see that recovery is possible through all, and that there's an ecosystem. We went to Burgess Falls the other day, and I was reading a plaque about this little invasive plant that looks like a cotton swab, and how it hinders the ecosystem of Burgess Falls, and how they're trying to eradicate it and struggling. That's addiction. That's mental health difficulties. And they're trying to make their ecosystem, from the trees to the river to to the plant life and then just people enjoying that. And I'm like, this is what we're doing in Upper Cumberland, is trying to eradicate this invasive foreign body to make our ecosystem in Upper Cumberland healthy, productive, happy, and UCHRA and DD, I'm all in, because that's what we do every day. Housing, transportation, connecting the local resources to meet whatever the need is. It's such a bigger picture and it's exciting, but I'd encourage you to read that participant story on the back of the flyer, because that is how we measure success of our programs. Somebody gets on their feet, they get through the struggle, they find hope, and they find purpose in their life.
I want to close with one last thing on this small story. We got a new CPRS. This young lady, right after she got furloughed for felony charges in incarceration, and she was released to our day reporting center, which Melissa Hoiston is the director over. And she was a hot mess. She was a hot mess. And she was diligent. She worked her way through the day reporting center. She graduated that program, and she went to work with Goodwill. And she was going up the Goodwill chain and doing a lot of great things over at Goodwill, to the point where they were going to make her an assistant manager. And she turned the position down, and because she wanted to be a CPRS. How better can we tell our story than to know that we've got a champion on our team now that is a certified peer recovery specialist that came to her at the utmost, at the worst, with a judge that supported her entering a program, graduating, and now she's changing lives. That's why we do what we do. Thanks.
All right, so you can see that there's lots of different parts, and we know we're still missing lots of things. We know that there's lots of gaps and barriers. So this is where we would like to hear from you guys, from what you've heard them talking about, the different pieces that we're focusing on, and how we're pivoting to that utmost goal of trying to get folks back in that workforce. What barriers, what gaps are you guys seeing from hearing us talk that you would like for us to look more into research? What are other things that you're seeing done outside the Upper Cumberland or in small places that we're not a part of? So I'm just going to throw that out to you guys.
I'm going to kick us off.
Okay.
And I'm going to tell you why it's important for us to have this presentation this morning. Now, not everybody in this room can say this, but Ryan and Michael, you've been there, you've lived it. And you're here today because somebody took a chance and wrapped their arms around you and said, listen, we're going to help you get through this. I dare say anybody walk in here and said they had cancer, everyone in this room is going to bend over backwards and do whatever it takes to get them in treatment and get them on the road to recovery and beat cancer. As a community, we have got to change our mindset on what it means to help somebody in recovery. I'm going to share a personal story. I've got a nephew sitting in prison over in West Tennessee because he got hooked on methadone. You know, it's taken him going to prison to get clean and sober. He couldn't get it there on his own. And he's had to spend that time incarcerated. And he's where he needs to be. He's ready to come out, and he's on the right side of recovery. But he's paying his price because it got so bad, he had to be incarcerated. Our hope is we catch our kids, our neighbors, our family members before they get into the court system, before they start down that path that if they may be to be incarcerated. That's where we've got to be. We've got to be proactive. We've got to move up. And getting people to realize it's okay to say, I've got an addiction issue. You know, one of the things, numbers tell a story, and I'm not going to go through the numbers here, but over half of our participants have come to us and said, I need help. They needed a way to get help. We need to figure out how.
I work every day to try to fight stigma. And I think everybody here does as well. I think it's just gonna be an ongoing and continuing process to make sure that we are properly educating and informing the people in our community what it looks like, because some folks haven't been touched by it, so they have a harder time maybe trying to understand it or process it or comprehend it. So I feel like, just continuing to promote recovery, providing the education and the information so that people understand that it's not a choice. You know where I'm going with that, Linnell? Okay, all right. The other comment I wanted to make, if this is okay, and it's back to Michael's presentation on the recovery-friendly workplace. Because I just spoke with an individual earlier this week that was in recovery and had a full-time job, which is just awesome, right? But one of the barriers is he's got a full-time job and he's in recovery. Because it takes a lot. Everybody's recovery road is different. Everybody's journey is different. And, it may be that, an individual can go to AA in the evening or NA, but they may need more intensive types of treatment. And so I'm hoping that with your recovery-friendly workplace, that we're educating employers on, these guys may have to miss some because they've got to go to an appointment or to a meeting or, because that is a barrier that I've recognized with some of our folks in trying to get the treatment and still being able to do everything else that they need to do, taking care of their family, working, making appointments, etc. Sorry.
I agree with that, and you're right, recovery's not a one-size-fits-all, it's tailored to that person. So some folks will have to have more intensive so that's a great focus with our outreach for our workplace and our employers.
I think another thing that I've noticed with majority of the people that I work with, and I want to say this in a very loving way because I know I'm in the Bible Belt and I love God. Jesus delivered me from the disease of addiction. I think that there is a very narrow pathway in this area itself, being strictly, faith-based is the way, which it is for some people. But I think being able to voice that everyone is welcome, and whatever gets you into the doors and whatever keeps you there and whatever your road looks like as you go, that's on you to kind of navigate and see what works for you. But just being able to maybe voice that if it's not faith-based, it's okay, right? Like, you're still welcome. We still want to help you. Does that make sense? I don't.
It does, because if you are not raised and grew up specifically in this region, then your religious beliefs, of course, are going to be and could be different.
Yeah.
And so what makes sense for folks who have always grown up in this area would be the faith-based. But someone from outside, no, and I agree 100% with that. But there's lots of different avenues, and not every avenue is the best avenue for someone.
Right. And I think even if you're raised in it, I know for myself, I was angry, There was a lot of things coming in that I was like, this isn't adding up, God, like, this is not fair. So, and, 2 years in, I grew up in Philly, so there's no churches on the corner. It's very different for me. But by the grace of God, I found him, and my life has been changed. But I was very angry and wanted nothing to do with God coming in. But that's besides the point. Just maybe being able to voice, like, hey, wherever you're at, whoever you are, whatever you're looking for, like, we want to help you.
We pride ourselves in being neutral.
Yeah.
We do get bashed a lot of times because we are partners with folks. There's this word out there, I don't know how many people understand it, and it's called substitution. And basically, a lot of folks like to say, well, they're just trading one drug for another. The word substitution is not actually a good word to utilize, but medically assisted treatment is truly the word we should be using. That's a stigmatized word too. But the reality is that they're not substituting one drug for another. They're seeking medical treatment, medical help to get over the worst tears and the worst pain and the worst side effects from coming off of some of the craziest drugs we've ever seen in the history of abuse. And finding that they can find sanity. Then there's, will they stay on it forever? Everybody's different. The brain takes up to 2 years, 3 years, 5 years to heal, depending upon how long they've been using. So we just have to combat that, and we have to do it neutrally. And but substitution's a big word.
That's the deal. Bill, you've been around a long time. If you could wave a magic wand, what is the Upper Cumberland missing?
Well, I like that. So, no easy questions. So we're working on a project that incorporates positive community norming, positive psychology, and there's a lot of study of those things as science coming out of Montana, out of the University of Montana. And it has to do, really, the simple way to think about it is accentuating the positive. And in prevention, we have not done that for years and years. We talk about overdose death rates, NAS, birth rates, addiction rates, criminal justice involvement. Instead of, and especially with younger people, really identifying the truth about what's going on with the vast majority of people. What is our true community norm? And I'm thinking, if you could get some people that are in recovery and do some media around them, some testimonials, just promote how good it is, and the stories of what all changed, for positive. There's thousands of good stories. And if you go to some of these 12-step groups, they're having a good time in there. I go to Will Roberts' Life Regeneration, Life Recovery group sometimes just because I need an uplift. I want to get in there and sense the camaraderie and the group supporting each other. So I'm thinking, build on the positive instead of trying to destigmatize it, make coming through that door something that looks very appealing. Flip the script a little bit.
I know you've worked a lot with the youth. What are you seeing? I know you've done a lot of work on vaping and stuff. What's the danger out there with our younger folks that getting hooked?
So they're not using, their past month use rates of opioids and meth are not bad, they're not alarming. But the mental health statistics that are coming out of our student surveys are very, very alarming. I was just looking at some of it yesterday, and something like, and this is 8th, 10th, and 12th graders, countywide, 10% have in the past year planned how they would commit suicide. 20 point something percent have said in the past month they have felt worthless most of the time or all of the time. 1 in 5 have reported that they feel worthless most of the time or all of the time. And there's some real, and it's statewide, it's not just here. This survey that we use is used statewide. And Christie can probably speak to that too. There's a groundswell of kids coming through that are having real struggles with mental health. And of course, they're going to try to self-medicate, they're going to try to find relief, where they can. But that kind of comes back around. We're trying to do a positive prevention project because, last thing that these kids that are feeling such distress need to hear is just more negativity about probably what their lifestyle is.
So do we think those children, with the more mental health, is this because, do we know, is this because their families are not stable and there's addiction issues in their families? Or are we showing any correlations with that? Or is it just social media and all the technology that's kind of leading to some of this chaos with their mental
And I
health.
honestly don't know, I think there's several theories, several possibilities that came up
All of those.
And maybe there's some thought that it kind of started, kind of a downward spiral with COVID and COVID. But, they're living in chaotic situations more and more. And hopelessness is just rampant among our youth.
And I think it's fair to say it's not just children either. That's the other dynamic. I know we run housing and Myra, we deal with issues all the time. I don't know if Crossville Housing is dealing with the same thing, but we run for the most part senior housing. So 60 and up, and we're dealing with more issues of selling of drugs and those type of things that we've already dealt with. So it's all across every age group, it seems like.
I think the big thing we've been seeing with a lot of people, but particularly in the like 18 or early 20s, is this 7-0H kratom stuff that's being just marketed in the stores everywhere. I mean, you can walk into a gas station, there's an entire wall of like, oh, energy, happiness, and it's a very addictive synthetic type of opiate that operates this, I think, very close to morphine, if I'm not wrong. Yeah.
They're called supplements. And if you know which supplements to buy, you can be high as a kite.
Yeah. Yeah.
Just want to say,
And it's legal.
I was gonna say, I'm so impressed with you all. I see them because we rent space at UCHRA. I see them coming and going, connecting, and I think that's what we're missing as a society is the community. So, I had the pleasure to work for Help Connect at night when I homeschooled my girls for a little while in an intensive outpatient as a co-facilitator. And they had to leave work be there by 3:30, and 4 days a week. And so, that's the commitment, working full time, and they miss their kids, and did safety plans, and 99% wanted to get better for their kids. One gentleman wanted to get better for him, so he could take care of his kids better. And I thought, that's, you have to have your goals. And I worried, they had jobs, and so I applauded them, but how much are they making minimum wage? The wage has gone better since COVID, but housing is just a concern because I love, Bill has, ambassadors and prevention of substance abuse. I applaud them. You've got full, I hope to be there tomorrow, right? Tomorrow's your meeting. But that's wonderful. These guys are building back what was broken. And I just worry about relapse. And so I think about housing, and I'm like, I'm obsessed with tiny homes. And Rock Island has a tiny home community developing. There's unique tiny homes being built here. There's one on Clark Range Highway in Monterey. They're building tiny homes. Van Buren has a community of tiny homes. Just something that could give people a stability, because I also don't like to see foster care. I don't want to see that going on to our children. And I just want families, that's a small community. And if we can wrap around them as a bigger community. But tiny homes is a great opportunity because it builds community. Those have a communal atmosphere where you don't feel isolated. And I think our kids are isolated with the social media that we've talked about. Anytime we can build a community, it heals us. And so I just thank you for this forum.
And you talk about housing, right? Housing is a problem in general. So now think about someone who does have a substance use disorder and maybe has something on their background, how impossible it's going to be for them to find housing because it's limited, and there's probably 15 people waiting for that that maybe don't have anything on their background or things like that. So it makes it even scarier, I think, trying to house folks.
I'd like to circle back a little bit to what Phil was talking about with focusing on more positive, it's like the framing of our messages to come up with positive spin. And also that there's a real science behind hope. That we use that word like incorrectly, and really like in the mental health arena, like substance use, we really want to provide someone with hope, because if they have hope, then they can, move forward. If they lost their hope, that's really like the basis, right? To kind of provide that hope for them. And there's a science behind it. the University of Oklahoma is behind it. They have an institute as well. The Montana Institute is doing a lot of work around positive. So it's really about the science of hope and how do we really delve into that. It's like a brain science. It's like the neuroscience, like hope. What is that? What does it look like? And how do we build that in individuals? Because it's easy to say, well, I hope you have a nice day. That's not really hope. So we use it wrong, you know. We have the hope is like internal. So how do we give that to people or teach them how to do that? It's like a science. It's like a whole. So I think that's like maybe something that to look into a little bit more about, you know, maybe even in programming, maybe you already, you know, implement that, but it's really the science of hope.
I think that's one of the key aspects of peer recovery and having peer recovery specialists. It's not talk about people that can dispense hope every minute. Because if I'm getting raining on the street and the person that's standing right next to me that says, we can do this together, all of a sudden I'm already involved in hope. And hope just is there at every step of the way, every time you can do this. And that's why our model is working and the numbers are happening, because we leverage peer support, people of lived experience that are meeting them exactly where they stand. Hope is huge in the recovery world, and you're right. I lived without hope for almost 40 years. I was successful, but I still had no hope. So I mean, but now you get into this new arena, and now I get hope for others. We give away what we give. Everything we do is because somebody sewed into us like wine. So hope is huge, and our peer recovery specialists are really, really great at the work they do.
Circling back around to the stigma, so would you say, do we have about equal number of men and women coming through their programs, or do you see one or the other is higher?
It looks like it's split down the middle.
So that's really good, right? That's showing us that we're doing something right to get the men to come talk to us, because we know that, you know, there's that toughness, that you're supposed to be able just to handle things, especially in the Upper Cumberland. So I think that speaks volumes that it is kind of split evenly, and we're not just serving women in this area.
I do want to say something, like when you guys share your story, you know, not only are you giving people who are in recovery hope, but you're giving families hope. So like when they hear those positive stories of, you know, our members getting healthy, they're, you know, trying, I think that not only just affects the person in recovery, but the people who hear the stories.
That may be a missing piece is family support.
Yes.
How do we support the family? Get calls all the time, mom, grandma looking for something for their son or daughter to get help. It's like leaving a horse of water and hoping to drink. Having the resources ready, if somebody does decide that. But in the meantime, how can we support mom, dad, and grandparents?
It's like yesterday.
So that they have hope, right? Because your family can turn into that hopelessness. They've maybe tried so many times, they've always relapsed, and so when does it come to the point where the family just has to throw up their hands, right, and say, I don't know what else to do? And that is the time they do support.
Coaching them on tough love, that's a hard one to try to do. Some family members, that's what my family had to do, cut it off and just pray and hope that I got better. But seeing that on the flip side, hope is the main ingredient to get whether it's the family or the individual to a better place.
I'm going to give you my ask for today. And every one of us probably knows somebody. They know an individual that's struggling with addiction, or they know a family that's struggling with addiction, or a coworker. You may not want to admit it, but you know somebody dealing with it today. Understand, there is no wrong door. I feel like in the Upper Cumberland. Bill, if they call Power Button, you know where to get them to help. If they call Cedar, you know where to get them to help. Volunteer. UCHRA, Development District. Pass that along. Don't, if somebody says they're struggling, they've got a child or a brother or sister, a husband or wife that's struggling, don't think you're hopeless. Help them understand there's no wrong door in the Upper Cumberland. You get to one of the partners around the table, you're gonna get every resource available, because we work very closely together, and very proud of that fact, so, that's my one ask.
Funny you say that. We got a call from John Rose's office yesterday. And they had a constituent, a grandfather, that they were asking, how can you guys help? You know you're doing your job right when, those folks say, call UCHRA, here's a number, call this guy, and he can help. And that's what we're trying to do, which we need to get this on all levels, and most definitely, reach out to your county, your county officials, the police, all those folks. We're here.
Can I address something? Just bringing it back to workplace, if you don't mind. Because you're trying to place people in recovery in jobs and workplaces. And I've been in the recovery program for 38 years, and so in this community. And back when I first came into the recovery program, Fleet Guard had a meeting twice a week at noontime at the facility. And if you're working with companies who are willing to take some of us in, would they be willing to allow a meeting at that facility so that they're not missing a meeting because meetings are so vitally important in my recovery program? And so looking at it from that perspective too, see, you're working with the employer. See if they're willing to allow that to happen on their premise, give them a space, a room. Because if they're hiring people who are in recovery, those people need that support. And if they get in a meeting at work, while you're eating lunch, it's killer to me. So, just a thought.
That's a great.
Thank you.
Has anyone seen?
I was just gonna say, there was a documentary, I'm sure some of y'all have seen it, it's been around a while, it's called The Anonymous People. Talks about a shift from anonymity to being proud of recovery, being proud of your time in recovery. It's out there on YouTube. I think it's about an hour, it's pretty watch. It kind of goes to the shift from, I don't want anybody to know I'm in this room to, I want everybody to know. Because it's going to be well received.
So maybe with your reference services that you guys are offering, maybe you could advocate for the county. Even if you could offer classes like tough love, like how do you provide tough love to somebody who you've raised or who has raised you? That kind of aspect of it.
Are there already established support groups for families in the upper county? Alabama. And so are those very widely available, or?
Yeah. Oh, yeah. I mean, there are schedules all over the place for AA, NA, Al-Anon. I print them out all the time.
If I'm not wrong, I think there's also like peers specifically related to helping the family.
Yeah, there is. That's one thing to call that.
Well, we're open to new ideas, if it's not right for us to do it, we're gonna go to a volunteer and say, you wanna look at it, or we're gonna go to Bill and say, you wanna look at it. But if you have ideas or suggestions, certainly let one of us know. We'll try to put together an application and find someone to do it.
It's also like the media, like the reels or something like that, that, focuses on the positive, and to really kind of bring down the stigma too. Because we do, like just like you said, Mark, everybody in this room probably knows somebody, or you know somebody who knows somebody, that is an active addiction or a past addiction or something like that, to kind of put it out, at least in our community, like maybe through Stonehenge, or just little snippets that people will hear.
I'm glad you said that. The video we showed that's AI. We created that, our AI guy created that in an hour.
That's good.
Little no work. Ryan, here's your advertising. Okay.
I'll plug the UC Recovery podcast. It's on YouTube and our UC Recovery Connect, LinkedIn, and UC Recovery Facebook page. We're trying to to ramp that up. We had our first episode come out the end of first of this month. So we got a new episode coming out next month. The first one was Paul Trivet from Cedar that St. Ferris on this next one. The goal is to share what the ecosystem looks like for us. These guys are on the upper end of the work, and eventually we're going to get down to the ground level and just share my story, share other people's stories of recovery and what it's been like working in that. But we've got some posts in the hopper for stigma. So just pay attention to that. Facebook, UCHRA on YouTube. And,
All right, now, Ryan, have you realized the error of your way? I'm just going to get on you a little bit. You picked Shane Ferris before you picked Ann Stamps. How could you pick Shane above Ann?
She was unavailable.
Okay.
Too hard to get to, right? So Ryan, maybe you could send us some of those links, how to access that to Sherry, and she could get that out to all the policy councils. And then if you guys have newsletters, if you have good folks to share this, go ahead and just keep sharing this. Ask them to share, so that we have lots of people following and watching this and help it gain traction. We depend on you guys to help us do things like that. So we can get that to Sherry, and Sherry can get it out to everyone.
I'm gonna give Christie a plug there. Your children and youth report that Bill referenced there, that's the true indication of our reach. But how the children are is how we are. And it's important for us to look at that.
Well, and I think it's important to do that work too, that prevention, both in the schools and in the homes, and, because it's a part of the family, because it is the ecosystem, right? So it's like everyone, just because that one person is evicted, it's the family, it's the eco map, right? So if you take the individual and how they're connected into the community and how their family connection, it's important. And I think it's important too to pass that on to people just in general, for them to do their own eco map, because then you can see the gaps where you have. That you have your faith, you have your friends, you have your neighborhood, whatever is missing, then you can kind of help them.
Any last minute thoughts and discussion before I turn it back to our board chair for the rest of our agenda? I do appreciate the discussion today. I think that it was fantastic. I think it's given us some additional ideas and avenues to look at, and we'll appreciate any attention that you can get to Ryan's podcast and things like that. Mayor, I'd like to turn it back over to you.
Thank you. You did a wonderful job. Sherry's about to fire me because I forgot something, didn't she? We have a motion to approve the minutes from the last meeting.
I move to approve.
Motion?
We realize you couldn't see the agenda.
It's clear on it.
Got a second? Second? All in favor? Motion carried. All right, any old business, new business?
I'd like to say something. I'd like to announce our Folks Have a Festival, which is not out of order. It's Jackson County, and it's the weekend, Mother's Day weekend. It'll start on Thursday and end on Saturday night. And another thing, I am trying to get enough people together so I can start a class and teach how to prepare post salad. And I've tried this is the third year I have recommended this, and I'm not getting younger, I'm getting older.
So, or maybe Brandy, you guys could work together. Brandy, maybe you could help her, see if you can find folks that would be interested in taking that class, different things
But
like
the
that.
thing I need is, I guess, is to advertise it. Of course, if someone is interested in learning how, because you have to be determined, you have to be dedicated, because it is a process.
You gotta do multiple boils, don't you?
Yeah.
Get rid of that vitamin A.
It absolutely has to be cooked correctly, or you can make
You sick, it make you very sick. I love cooked salads.
But I just want to, and director, 5 years
To go and forgot about it, but That's another thing, somebody needs to come to our town and teach all of our people how to do chocolate. Get her choice, you can send down folks out to chocolate.
Got any wood gravy on the folks out.
I don't recommend it either.
All right, any public comments?
So I've got, Governor Putnam's meeting tomorrow, is courtesy of volunteers. So we're not going to be at our regular meeting place at Clayville Police Department. We will be in volunteer community need facility, which is around back and the old, what is it, you live? And if you haven't seen it, it's worth coming to that meeting, just to see their gorgeous new conference room that we built back there. So everybody can, especially you.
Anything else?
I do have one thing to bring up. So we have sent the link for our community needs assessment through the Community Services Block Grant. And we are doing fantastic with getting partners and elected officials and things like that. What we're struggling with is actually getting clients. We know that it is a longer survey, but these are required questions through the Community Services Block Grant. So if you can help us by helping clients fill that out, we would be so appreciative. This is really how we make the case of how that money will be utilized for that Community Services Block Grant. So these are very, very, very important surveys. So we would appreciate your help on that client side if you could.
I would just like to share that our Upper Cumberland Council, the Tennessee Christian Youth, is having our annual legislative breakfast. It's on April 10th, so from Friday, and it's right here. And we have Hattie Graves, our policy and data person, who will be presenting on State of the Child, so if anyone's interested in some of that data as well. We have Felicia Harris and David Inhoff from Department of Children's Services, and they will be talking about the State of the Child here in the Upper Cumberland. So in addition to other speakers as well. So it is a free event, and it is here from 8:30 to 11.
So no sign up, just show up.
Is it okay if you just show up?
Is there a sign up?
There is. It is on Eventbrite, and I can send it, if it's possible to send it to Sherry, and you can send it. Okay. If you wish.
You got a really good breakfast.
And also, just to share that the Putnam County Blue Ribbon Committee is hosting a day-long event, also here at the Development District. We're so grateful to the partnership in the community, but it is a day-long event, and it's talking about child abuse awareness, but not only just child abuse awareness, but it's called announcing prevention. So we're having numerous speakers throughout the day. It's hand stamps is one, talking about mental health and also suicide. But we have the Children's Advocacy Center partnering with the Department of Children's Services, talking about protective factors. We have the Stevens Center talking about child abuse. We have the Eye Centers of Tennessee who will be doing a presentation on eye care. We're partnering with the Health Department. We're doing several speakers about the new immunizations, the vaccinations, oral health, help me out, exercise, nutrition. Oh yes, Mateo from, he's going to be presenting on drug and danger children. So it's a day-long event. We have breakfast, will be from Panera, and Outback is hosting and sponsoring our lunch.
Ooh.
And when is that?
This is on April 17th. And it's right here, 8:30 to 4 at the Development District, and I can also send that flyer. But it is a free event, and as I said, it's just it's an ounce of prevention. Again, like what can we do as families, as individuals, as agencies to really promote that health, mental health, physical health for our kids.
Anything else? Motion to adjourn?
Motion.
Second? Go on.
Thank you, guys.